Welcome everybody.
I'm delighted to welcome everyone to the professional day of the Association's 78th Annual Conference. The ongoing challenges facing our professions are greater than ever, which is why events like this become so important. It gives us the opportunity to draw inspiration from thinkers and doers who are also voices for change in their chosen fields.
You have to keep the passion and you must persevere. I cannot stress to you enough the persistence, the determination, and perhaps on occasions, the courage you are going to need to challenge what will be put in your way.
I thought Mary's talk was extremely inspirational and valuable. It made me feel seen.
I am in awe. What a legend, amazed. How true is every word she said.
That nursing grit that we have is what we need to really keep pushing.
The genie's out of the bottle. We know artificial intelligence is here.
Healthcare is complex. And there's always going to be room for improvement in everything. And there are a lot of people who are saying that AI can be that improvement.
There's so much happening, but still a long way to go, especially for nursing and midwifery space. And it's on us to now embrace it and get involved, participate in projects that include AI and technology.
Can't say that I am convinced. I feel like it's given us more questions. But really interesting, I think, where that study's going.
There's this difference between AI doing things for you and just relying on it totally, but we really need nurses to still be nurses and make those decisions.
Nursing is a career that's here to stay, not going to be replaced anytime soon by any algorithms.
So the challenge for us is how do you balance your giving quality healthcare but improve your general sustainability?
When we look at our carbon footprint of healthcare, we can make an impact on waste. Lots of changing thinking, changing habits.
Without appropriate responses at policy level, state, national, international, without investment in the current nursing workforce and those who will come next, the gap between demand for nurses and supply of nurses is going to grow ever wider.
It's issues that are really affecting our workplace at the moment. Something needs to be done about it, and it made me feel like I'm empowered in being here.
Could you please give this presentation to the New South Wales Premier, Chris Minns, tomorrow?
We'll all have a range of power or social and political capital, often that we don't really recognise or realise how much a voice we have.
I really enjoyed Craig Foster's speech. I thought he was inspiring.
He's a really good speaker, and listening to him speak on human rights was just inspiring. I really loved everything he said about the Matildas too. I was such a fan of watching that. It was just, the empowerment of being a woman in this current time is legendary.
It's been great. It's been a great experience for me. It's the first time here. I've learned a real lot so far.
And I love coming and looking at all the trade displays, getting some great ideas.
So we all have a responsibility to challenge, to think outside the square and to stand up for the betterment of our members and the community. Let's address the areas where we can do better, but let's not bathe in them or let them become us. Negativity is not our friend.
I'm confident that together we can continue to be an even greater voice for change, and we can meet the challenges we face by working as a collective and make the most of the skills and knowledge of our robust and growing membership.
The work you do matters, not just for the people of New South Wales, but globally you are inspiring nurses and midwives.
On election night, I made a promise to lead a government that puts people at the heart of all decision making and in particular invests in the most precious resource we have in this state, and that is the human capital, the people that make up essential services. On the top of our list is repairing and reforming our healthcare system. And the only way we're going to do that is in unison with our essential workers and of course their elected representatives.
We will improve a health system together. As we roll out safe staffing, the most significant reform of the way in which we staff our hospitals in probably around 15 years, there will be bumps and problems along the way. But let me assure you, you have in me a minister who's not only deeply proud to be your Minister for Health, but is determined to make sure that I improve a health system for those patients who need it, but also for the workforce who delivers it.
Our members are very interested to hear how you plan to staff the safe staffing ratios rollout.
It's not just about recruiting junior nurses, okay? Yes, they're important. I'm not saying they're not. But we've got to keep the ones that we have.
When will Labor give newborns, not in the NICU, but with their mothers on a hospital ward, the respect of counting them in the patient numbers of public hospitals?
I don't have an exact date, but if I can leave you with this, that it is an area that I'm well aware of. This needs to be an area of reform that we need to work on, and we will.
I did think that they came with a very equal, level-keeled approach, trying to explain the fact that they can't wave a magic wand and fix all our concerns all at once. However, I do think it's appropriate that we keep applying pressure.
They listened, they heard what we said, and I was appreciative of the fact that something started, at least.
The Health Minister, he's doing better than the last one that we had, that's for sure, but that's an incredibly low bar. I think that he seems like he genuinely does want to address the issues, but it's just, we know how much of a crisis it is.
The number one issue across the country for workforce is retention.
It's absolutely awesome. The highlight moment, to be honest, was probably having the photo this morning.
The guiding principle itself is simply recognition of Aboriginal and Torres Strait Islander people as the First Peoples and a voice so that we can make representations on the matters that affect us.
To enshrine in the Constitution the right of Indigenous people to actually be heard. Not to tell the rest of us what to do, not to dictate to the Parliament, but simply to be heard.
Well, my wife's Aboriginal. My children identify as Aboriginal. It was good to hear Kerry address the disinformation and actually put forward the point that the voice will actually help create unity and harmony in this country and help bring people together and redress some of the mistakes of the past, and we can move forward.
You should be proud of how far we have come thanks to your efforts and your strength to stand up and speak out. And sometimes that takes great courage. Believe in your work and believe in your strength.